this is Dr. Lester Hartman. I'm going to talk to you today about the FL100 oximeter. You can get on Amazon, and right now we're trialing it with a group of patients. And I just want to tell you the purpose and why we like using this. First of all, adults use this who have COPD. It has not been trialed that much with asthmatics at home, but are done multiple times in the office. Number one, it's called the fifth vital sign. That means temperature, respiratory rate, pulse, and blood pressure. And the fifth vital sign ends up being an oxygen level reading. So this tells you what your oxygen level is in the blood. Generally, things that are over 94 or at 94 are normal. But oftentimes with asthmatic, it starts out low until you've given nebs and see what happens. The key thing is when somebody uses these, the child should be over 4 years of age and there should be no nail polish on their fingers. That will affect the reading. So when you do one of these, you take your time. And it's very helpful to know their response to treatment, how much the oxygen level went up, and also when you call the office to give an oxygen level. Now remember, you should never, ever rely just on this. A child can have an oxygen level of 100 and be breathing rapidly as well. So you have to look at the whole child, their color, their respiratory rate, can you see their ribs, and if they can count to 10 without taking a breath. For example, some kids will count and they can't. They'll go 1, 2, 3, 4, 5, 6. You know that they're short of breath when they count to 10 and they're doing that. So let me show you how to use an oximeter. First of all, you turn it on, like that. And then what I do is place my finger, the whole length of my finger, into the first part of my finger on there. And then as you can see, you hear the pulse. It's a regular beat. Doot, 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 doot. If you don't have that, it is an inaccurate reading. So I will take a look at this now to see if the oxygen level is shown. Yes, well, we'll go this way. So the top number here is the oxygen level. Remember, I said 94 or greater, and the bottom 98 is the pulse, or at this point 90. And it can vary anywhere from 96 to 100. So the key is you record these, and if you need to call the office, you can tell them what the oxygen levels did in between treatments. Now remember, the beginning of a treatment, you may find that after one treatment, the number goes down a little bit for a few minutes and then starts to go up beyond the level it was before you started a treatment. So in other words, say it was 92, and then you do an oximeter reading, it goes down to 90, but you wait a few minutes and it goes up to 94. That's the response to the medication, number one. Number two, have a baseline on your child. In other words, just try this when they're well and see what their baseline range is. Again, it should be over 94%. And always do a measure before you start a nebulizer treatment. Let me try to show you what happens where it's not reliable pulse. So I'm going to place it on my small finger. And again, this is people who are over 4 years of age. Now, again, that's regular. Boop, 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 boop. Now it's skipping. So that means it's not regular. So that means you're not getting a reliable reading. You've got to try again. Always use the index finger and put it again all the way in. We will give you more instructions to this when you receive one. This can be a very helpful device. And again, always get a baseline on your child when you're starting the nebulizer and before. Never have nail polish on their fingers. Always make sure that the pulse is regular. Beep, beep, beep. And if you don't have a regular pulse, then the reading is totally inaccurate. Normal is 94 or above, and children often start at an abnormal level when they're having a true asthma attack. A key place this can really help is the coughing child, where parents worry about a child choking to death. If you put this on their finger and they're coughing but their SATs are well within the normal range, 94, or in between their coughs, it goes back to normal. This makes it not concerning and can reduce your office visits potentially, or an emergency room visit because you're so frightened about your child's cough. And again, this can be invaluable, especially with kids who are on things such as Atrovent or ipratropium and really are not using any other meds for a cough variant type asthma. This is Dr. Lester Hartman from Westwood Mansfield Pediatrics, proactive in your child's care. Please remember this is just for patients in Westwood Mansfield Pediatrics. And I will be supplying these to specific patients to start the program. Again, this cost $18, so it's not that expensive. Have a good day.